Hello, my name is Zoyina, and I want to talk to you today about maternal mortality and race in the United States. Maternal mortality and infant mortality is a public health issue in the United States. Studies are showing that the United States have higher rates of maternal and infant deaths than in other developed nations. The causes of mortality are highly preventable. The social determinants include race, socioeconomic status, education, and social demographics. Now, the case study that inspired this presentation is a case of Miss Shalom, in which the study showed that Black women receive inferior health care services despite their social status, because she was an educated and highly accomplished lady with access to healthcare services. But that was not enough to save her life when it really came down to it. So yes, the main determinant that is a public health concern when it comes to maternal and infant mortality is race. Um, So studies show that increased maternal mortality remains a major problem among Black women who are awaiting motherhood or have just become mothers. The context here is revealed in health statistics that indicate a disparity in mortality rates in the United States, with Black women being 3 to 4 times higher at risk than of dying during childbirth or prior to childbirth than white women. Social determinants also include discriminatory service delivery, lack of access to healthcare, social isolation, high pressure life, inadequate prenatal and postpartum care. So let's look into the social ecological model and how it impacts maternal and infant mortality. So at the individual level, positive coping and self-care is a positive coping factor, obviously, but poor beliefs and negative attitudes towards proper healthcare practices can be a factor that inhibits one's access to healthcare. If you don't have a positive experience with your healthcare providers, or if you do not feel like they have your best interests at heart, you might be reluctant to seek services with them. On an interpersonal level, you have to have a good relationship with your provider. But then if you don't, you also lack social support from family and peers, you might, be isolated and not be able to seek services or even know that you need to seek services. At the organizational level, health insurance coverage might be an issue. People might even be underinsured or not even know how to utilize the insurance that they have. Community-based organizations supporting maternal and child health care might not be easily accessible. Now, at the community level, dangerous and poorly sanitized neighborhoods may create stressors to maternal health. Health research collaborative and media have great impact on supporting maternal and health childcare through reducing social isolation for those who have access. Policy levels, our healthcare policies may have discriminatory immigration and health policies that also impacts maternal and child mortality. So we need a sound health research system that supports inclusivity and make sure everybody has access to proper health care, you know. So public health interventions that can help improve maternal and child health care is if we can collaborate with stakeholders, government and non-governmental organizations, medical professionals, public health officials to promote educational campaigns to raise awareness of issues related to maternal child health mortality, trainings for health professionals to help with effective education, diagnosing, treating, and providing preventative measures, creating effective systems for health professionals and medical providers to share and exchange medical information, early onset reproductive health education campaigns in middle schools, high schools, colleges, and universities, health education campaigns during annual healthcare enrollment in the workplace or through women's clinics such as WIC or state-run women's clinics, reproductive education during wellness checkups in prepubescent and adolescent children, education on preventative practices to protect infants in utero and after birth, education, preventative care, and postpartum follow-up care for new mothers. These are all interventions that we can try to incorporate in our existing services to prevent maternal and child mortality. Now, evidence-based interventions. Evidence-based interventions that I have in this presentation is basically like medication that can be given to women at risk of preeclampsia, eclampsia, postpartum hemorrhage, to help prevent death. And this should be they should be monitored prior to birth, during pregnancy, prior to birth, and after birth to make sure that they remain healthy. And these are just supplements or medication that has been proven to reduce maternal mortality rate. So magnesium sulfate has been evaluated, and if it's administered to the current target group, the outcome will be to reduce risk of seizure in pregnant women, and hence there'll be low mortality rates. Evaluation for oxytocin, the impact measure will be to increase use of oxytocin as a treatment with the outcome measure, being that mortality will be reduced. Mortality related to postpartum hemorrhage will be reduced. For calcium supplementation, just adding calcium to the diet, or like getting calcium supplements from caregivers will help reduce seizures and consequentially reduce maternal mortality. The challenges that we might face with giving these interventions, resource constraints. And that's not just only material resources. We're obviously talking about lack of trained personnel, lack of infrastructure, cultural beliefs, and just like negative beliefs and practices when it comes to people working with providers, lack of community trust. So a way to solve this problem goes back to the public health interventions that I proposed earlier on, and it's just to collaborate with stakeholders and to embark on media campaigns, educational campaigns, work with stakeholders, create effective systems that will enable health professionals and medical professionals to work with these families. And then we can also adopt the use of traditional practitioners like doulas and midwives to help women throughout the duration of pregnancy and after birth, to help them seek services and develop trust between caregivers, and so on. Thank you very much for listening to my presentation, and please review my references and PowerPoint for more information on maternal and infant mortality. Thank you very much again.